This video is about hemophilia. Hemophilia means blood liking or liking blood. There's two types of hemophilia. What are they? There is hemophilia A and hemophilia B. What kind of defect or deficiency occurs in hemophilia A? In hemophilia A, you have a factor VIII deficiency, and a factor VIII deficiency in hemophilia A is basically part of the intrinsic pathway. You also have what factor is deficient in hemophilia B? In hemophilia B, you have an you have a factor IX deficiency. What is the clinical presentation of both hemophilia A and hemophilia B? They both present with prolonged bleeding, because remember, factor VIII and factor IX are coagulation factors or clotting factors. They help to clot the blood. If you have a defect in a blood clotting factor, what do you think that's going to cause? It's going to cause easy bruising, easy bleeding. And these patients are going to be often children that present with prolonged bleeding, epistaxis nosebleed, gum bleeding, easy bruising, swollen joints because of hemarthrosis, which is blood depositing in the joint. So that's hemarthrosis. Now, these are symptoms, and these clinical features are both in hemophilia A and hemophilia B. Let's zoom in on hemophilia A. Hemophilia A is an X-linked recessive disorder, meaning it commonly occurs in boys. And as it occurs in boys, it's basically when the mother is a carrier of hemophilia A and the boy only gets one X chromosome from its mother, that is why boys are going to inherit this X-linked chromosome, which is carrying the hemophilia. It's a hemophilia carrier. And that is going to lead to hemophilia A in the boy. It's a factor VIII deficiency, and it affects boys because of the reason I just said, but it can affect women in Turner syndrome or skewed lionization. So what's the pathophysiology? Why is factor VIII leading to this prolonged bleeding? So mutation of the factor VIII on chromosome X will lead to less factor VIII being produced. It's defective factor VIII. Factor VIII is necessary to form thrombin via the intrinsic pathway. This will lead to prolonged APTT. What is the classification of hemophilia A? The answer is there's three classifications, which is mild, moderate, and severe. And the classification is based on the residual level of factor VIII, which is left over, the residual level. So mild will have more than 5% of factor VIII. Moderate will have 1 to 5%, and severe will have less than 1% of factor VIII remaining in the circulation and the circulatory system. The mild type of hemophilia A only causes bleeding after trauma or surgery. But the moderate type of hemophilia A leads to occasional spontaneous bleeding, and the severe type leads to bleeding over minor things or severe spontaneous bleeding. Your investigations in both would be doing a coagulation screen, which will be performed in all patients, but what you will see in a hemophilia A is you will see a normal PT, because remember, it's the APTT which is affected because we're in the apartment. Remember, intrinsic pathway affects the APTT because we are in the apartment 13. So it's a normal PT but a prolonged APTT, and your main investigation will be a factor VIII assay, whereas for hemophilia B we will do a factor IX assay. So for hemophilia A, do a factor 8 assay, which will show low factor 8. Treatment for hemophilia A, you want to give them supplemental recombinant factor 8, okay, which can be IV plasma derived or recombinant. You want to basically replace what's lost, so you're going to replace the factor 8. And for minor bleeds or residual levels more than 0.1, you can give them desmopressin. You can give these patients desmopressin. Desmopressin not only increases the levels of clotting factor 8, but it also increases von Willebrand factor. Hemophilia B is a disease called Christmas disease, and it's a deficiency of factor 9. It presents the same way, except this time, let me just check. This time we won't be giving desmopressin in hemophilia B. Why don't we give desmopressin in hemophilia B? We don't give desmopressin in hemophilia B because desmopressin only increases the levels of factor 8. But here we have low factor 9. And again, if APTT is high, you know that it could be hemophilia A or hemophilia B.